All right, well, let's get started. Good morning, welcome, and thank you for joining us for the Critical Access Hospital Community Health Needs Assessment. Are you capturing all IRS general requirements for tax exemption? This is brought to you by the Iowa Department of Public Health and the Iowa Healthcare Collaborative. I'm Carrie Sutton, the Community Quality Initiatives Director at the Iowa Healthcare Collaborative. Before I introduce our speaker today, I'd like to first share a few housekeeping items. Continuing education is available for this webinar, as you see here noted on the slide. There is one nursing contact hour. Nursing contact hours, to be awarded, you must have provided your nursing license number and be logged in individually for the full duration of the webinar. No partial credit will be granted. There is CME credit as well for this webinar, approved for a maximum of 1 AMA PRA Category 1 credit, as well as DO credit as noted here on the screen. For other healthcare providers, you can see the 1 AMA PRA Category 1 credit as well. If you haven't already, please register for the remaining 2 webinars so you can receive the maximum credits available for this series. We'll share the webinar series brochure following this presentation so that you have access to the registration link. As part of this webinar, you'll receive an email with a link to complete an online evaluation. Please take just a few minutes to complete the evaluation. A certificate of attendance can be used for all self-reporting continuing education credits and can be printed after completing the evaluation. IHC does encourage you to keep a copy of the webinar agenda with the certificate for your records. And as many of you have demonstrated, and as it is our new normal, the chat box, because all of you are currently muted, we will utilize the chat box, and we highly encourage you to interact and ask questions utilizing the chat box. And if you're unfamiliar, the chat box is found at the bottom of your screen. We do have IHC staff members that will be monitoring the chat box. We'll address questions broadly as it relates to the content that you'll hear from our speaker at the end of the presentation or as prompted by our speaker. But if you have any technical issues, don't hesitate to let us know and our staff will assist you. We are recording this webinar, and so you will receive an email with the information on how to access the recording following today's presentation. Funding for this webinar series is provided by the Health Resources Services Administration, the Rural Hospital Flexibility Program, also known as FLEX. As noted on the slide, there are 4 areas offered via the FLEX program: quality improvement, financial improvement, operational improvement, and population health. This education series is part of the population health area of support. The purpose of the overall educational series is to increase understanding of hospital community health needs assessment, the requirements and the processes, so that we can lead to a well-developed, meaningful community health needs assessment overall. This is the first of 3 webinars IHC is providing to support CHNA technical assistance. The Iowa Department of Public Health, led by Cassie Kennedy, will also be providing individual technical assistance. All right, so now for the meat of our presentation, I'd like to introduce our speaker. David Palm is an associate professor in the Department of Health Services, the Research and Administration, and director for the Center for Health Policy in the College of Public Health at the University of Nebraska Medical Center. He teaches courses in strategic planning and health policy, and has conducted several evaluation projects, including an examination of the community health needs assessment and implementation plans of all nonprofit hospitals in Nebraska. Prior to joining the College of Public Health, he served as the director of the Office of Community and Rural Health in the Department of Health and Human Services, where he worked extensively with rural physician clinics, hospitals, and local health departments. His office managed several grant projects, including FLEX and the Office of Rural Health Grant. He received his bachelor's degree in business administration from Augustana University, a master's degree in economics from the University of Wyoming, and a doctorate in economics from the University of Nebraska-Lincoln. So thank you, David, for joining us today. I'm going to hand it over to you.
Well, thank you very much. It's a real pleasure to be here today and to talk about this really important topic. Several years ago when I read the Affordable Care Act and saw this provision, which incidentally was really pushed for by Senator Grassley from Iowa, that I really became excited about the possibilities of coordinating planning and implementation across counties and across communities, and really involving hospitals, which prior to this, I think some had been involved, but many had not. So we want to talk about some of the issues today, and of course, talk about the requirements. So next slide, please. And I have no relevant financial conflicts. Next slide, please. So today we want to do three things. We'll cover the general requirements for the community health needs assessments and implementation plans that all nonprofit hospitals have to do every 3 years. We'll discuss the strengths and weaknesses of the Iowa needs assessments and implementation plans, and present some best practices to overcome these weaknesses, and describe how this process can be used to improve the health of individual patients and also the overall population. I know that you will have other webinars coming up that will talk about some best practices, forming partnerships, building smart objectives, and so on. But I hope to kind of whet your appetite in terms of what might be done to help improve and move us forward in this area. Next slide, please. So the general requirements of the community health needs assessment, I'll just list these and then we'll talk about them, of course, in more detail. What you need to define your community. What is your service area? Assess the needs of the community, which can be complex or very simple. Solicit and consider input from persons in the community with special knowledge of public health and have broad interests of the community. And of course, prepare a written report and have it adopted by generally your board if you're a hospital, and make it widely available to the public. So let's get into some detail. So next slide, please. Well, in terms of defining the community served, that you're going to define a geographic area. And if you're a small hospital, that probably means the county in which your hospital is located. Now, I know that some hospital service areas spill over into many counties, but unless you have a major population from that particular county, you don't want to get too big in terms of your defining your community, because then your data analysis becomes very complicated. For most hospitals, you're going to have to serve the entire population, but of course, we have children's hospitals and we have hospitals focused on heart disease and orthopedic surgery and so on. And it's also very important to not exclude medically underserved, low-income minority populations. So you don't want to draw your service area so you exclude those populations. And of course, if you're in a rural area, you're just going to be serving the entire community or county, or perhaps 2 counties. Next slide, please. So what about assessing community needs? And you really want to think about how you want to approach this. And it's really a good idea to work with your local health department, or if you do not have a local health department, the Iowa Department of Health, your Office of Rural Health. But you want to look at the health status of the population, which generally means you want to look at some birth and death data, mortality data. You probably have access to your own hospital discharge data, perhaps cancer registry data. there are multiple data sources that one can use. Some hospitals also do surveys, maybe in conjunction with their local health department, of people in their county or service area. There are also risk factor data, such as obesity and tobacco use, through the Behavioral Risk Factor Surveillance System, sometimes called BRFSS or BRFS, goes by a lot of names. And then also the University of Wisconsin County Health Rankings, which is funded by the Robert Wood Johnson Foundation, does county level analysis. And I would encourage you to look at those data because they will rank your county from 1 to however many counties you have in Iowa in terms of their health status and other indicators as well. There are access barriers such as insurance coverage or obviously shortages of health professionals, which you can go to the BRFS survey. Your Office of Rural Health will have health professional shortage areas, which you can look at. And also an area that's really gotten a lot of interest over the past few years is to look at the social determinants of health, such as inadequate housing, food insecurity, which you might be able to do if you're screening for this, you're screening your patients for these determinants. The US Department of Agriculture also has done some surveys, and there are other ways. I was writing a grant recently and just Googled survey data for some of these determinants, and I was able to find 2 or 3 sources that I didn't realize. Then also, it's important not to forget behavioral health because it usually comes up as a top priority. So your BRFS survey and patient screening, perhaps through a PHQ-9 or whatever other screening tool you might be using, can be useful information. So these are not all of the data sources, but this will give you some idea of what you might be able to do when you're looking at community health needs. Next slide, please. You also want to get input from the broad interests of the community, which would include your local health department or your state health department and or your state Office of Rural Health. So you might want to make a personal visit to them to find out what data are available, what information that they might have that would be useful to you. There might be some special surveys that have been done, for example. You also want to contact members of organizations representing medically underserved or low-income minority populations. You might want to conduct focus group interviews or broad community meetings, or maybe just key informant, single person interviews where you talk to individuals on a personal basis, which is always a good way to get good information. And then also consider the written comments that you might have received on your most recent needs assessment and implementation plan. Next slide, please. And there are a multitude of other sources that you can use, and I'm sure you're aware of these. Your consumers or patients, nonprofit organizations, community action agencies in our state are very useful. Local health department, local government officials, schools, the faith community, obviously other healthcare providers, large and small employers, and so on. So think about cooperative extension sometimes is a good resource as well. Sometimes economic development agencies. They all do some kinds of needs assessment at one time or another. And so they can be good sources of information. Next slide, please. One of the most important things you're going to do is you're going to accumulate a lot of data and information. And if you ask people what they think are the high priorities, they'll usually tell you. And so you would just accumulate a lot of information. And somehow you have to narrow that down and set priorities. And I think this is probably one of the most important parts of the process. So how do you do that? Well, there are different ways that you can go about it, but you need to set some criteria in advance. For example, what's the magnitude of the problem? How serious is the burden or severity or urgency of the need? What are potential effectiveness of possible interventions? Some things we just don't know a lot about at this point, and so it's difficult to really intervene effectively. What are the health disparities associated with the need? Perhaps diabetes overall is not an important problem in your area, but it might be an important problem for certain underserved groups or minority groups. So I think it's important to look at that. And then also community readiness, or the importance to the community. So in some instances, the community may not be ready to address an issue if it's particularly sensitive. But on the other hand, they may also be very ready to move forward. And if they are, you want to take advantage of that. Next slide, please. So once you have your priorities, then you're going to think about writing your report. And it's going to include the definition of your service area and how that was determined. And that should be relatively easy for you as a hospital to do that. You know your service area and what it is comprised of. And so you should be able to come up with a justification there. Then also describing your process and methods used to conduct the needs assessment. What data and information did you use? What methods did you go about of collecting and analyzing the data and information? And whom did you partner with? Did you partner with your local health department, your state health agency, or perhaps a consultant? I've seen consultants do actually very good work, and some do not so good work. But you know, you need to identify whom you worked with on the process, the community health needs of process. Next slide, please. And then also, you need to describe how the hospital solicited and considered input from persons representing the broad interests of the community. So if you did surveys, describe those surveys. If you did focus group interviews, how many people were in the focus group interviews? What was the general content that was discussed? What were the questions? What were the outcomes? And so summarize that input. Or you may have had a community town hall meeting to get input as well. And so you want to obviously identify these organizations and individuals that provided input. Now, you may want to not quote them directly, obviously. There needs to be some confidentiality here, but in general, what types of groups did you seek input from? Next slide, please. And then describe all this, your health needs, your process, your criteria used to set priorities. And then very importantly, and this is sometimes difficult for hospitals, to describe the resources that are available to meet the needs. Most hospitals will describe the resources that they have within their four walls. But there are other resources as well from your local health department, from cooperative extension, from other community-based organizations, or other types of healthcare providers that might also have resources to meet these needs. And then you want to evaluate the impact of your previous needs assessment to make sure that you know what has happened since that time. And frankly, this is an area where hospitals don't do very well, and we'll discuss this in more detail later on. But if you can do a good job of evaluating how well you've done in addressing your previous priorities, that should also give you an indication of how well or what you need to do to address your current priorities. Next slide, please. And you may want to collaborate between hospitals for your community health needs assessment, or you may want to develop a joint community health needs assessment. I'm really not familiar with anyone who's developed a joint community health needs assessment, and perhaps we have someone on the line today who can talk more about that. I am familiar with hospitals that have gotten together to do joint planning. For example, the Omaha hospitals do this along with the local health department and many other organizations. So they all come up with the same priorities, but they all write a separate community health needs assessment. So there are some different options here. And of course, you may simply more likely you're just going to write a community health needs assessment on your own. Next slide, please. Well, you must make this report widely available and put it on your website. Have a paper copy available so if someone comes in, they can look at it. And also, please keep in mind that you want to keep your previous needs assessment on the website or available for review. You can take down that 2013 or whenever you did your first needs assessment, but you need to keep the last two, your current one and the one before that. And I know that when I look for the previous needs assessment, sometimes I just can't find them at all. And sometimes I have a difficult time finding the current one. I have to really do a lot of clicks to get there, but eventually I usually get there. A couple of times I had to make a call and say, gosh, what happened to your community health needs assessment? And they'll say, well, it's on there somewhere. And then we eventually find it. So make it fairly easy to find. Next slide, please. Also, your implementation strategy is a written plan that the hospital, decides how they're going to address each significant need. And this is more difficult to do, I found, when I've reviewed implementation plans than the actual community health needs assessment. So you need to identify the need or explain why the need will not be addressed. So you're going to come up with multiple needs, and then you're going to set some priorities. But your priority needs will probably be addressed in your implementation plan, but there may be other needs that you should at least identify and explain why you're not going to address them. Next slide, please. So addressing a significant need, you need to describe the actions the hospital intends to take and its anticipated impact. So what are the activities that you're going to do to address this high priority need? If it's a mental health need, if it's obesity or a chronic illness, what are you going to do? And what resources will a hospital commit to these activities? They could be in-kind resources, or it could be new investment of funding. And also describe your collaborative efforts between the hospital and the other partners. Uh, I found that most hospitals, not all, but most hospitals don't do a really good job of describing what their partners are going to do. They might say, well, we're going to partner with our local health department to generally look at some best practices that have been tried elsewhere. And they become very general kinds of things. But I would encourage you to not only be specific in terms of what the hospital is going to do, but what specifically are your partners going to do? How are they going to address the issue? Next slide, please. So there may be also good reasons why you're not going to address a significant need, maybe even a high priority need. There could be resource constraints. And we found this when in the first iteration of the community health needs assessments, where mental health especially came up as a high priority. And people said, well, what can we do? Uh, we have a shortage of health professionals. Some people don't have good insurance coverage. There's a real stigma in our community about seeing mental health professionals. Um, we know the suicide rates are going up, but we just really don't know quite what to do. Now, I think over time, more and more hospitals have worked with other partners on this particular issue. But there may be issues where there are major resource constraints that you might be not able to address. And of course, other hospitals or organizations might be addressing the need. We found also that one of the needs that frequently came up, maybe not as a really high priority, but as an important need, was something like dysfunctional families. And hospitals kind of said, well, gosh, and even local health departments said, what can we do? What can we as an agency do or an organization do? And they looked around and they found that there were other organizations that were trying at least to address this need. Now, they may need more support in other ways, but that's an example of where maybe you do not have the competencies or expertise to really address that particular need. Or the assigned priority was really very low. And this can happen, or there's a lack of effective interventions. We'll talk more about this, but if there aren't best practices available, maybe you can implement a promising practice, but maybe again, your community is not ready to address this particular need, and there are no effective interventions. So that's a good reason why you might not want to move forward on it. Next slide, please. So again, you can have joint implementation strategies where you might want to collaborate with other hospitals and organizations, but write a separate plan. But again, clearly define the hospital's role and the roles of other organizations. So that's, I can't emphasize that enough. Next slide, please. Well, same as with the community health needs assessment, you want your board to adopt the strategy. It must be done before the 15th day of the 5th month after the end of the taxable year. So you have a little more time to do your implementation strategy, but keep in mind that it needs to be done, and this is really an important aspect. I've been involved in health planning on and off for a long, long time. And I can tell you that in any health planning endeavor, implementation is always the most difficult aspect. There seldom are enough resources. And sometimes we reach planning fatigue. We worked and worked and worked to get a plan developed, and now we got to implement. I also teach strategic planning, and of course, this is one of the most common uh, uh, negative things that happens with strategic planning is that we adopt a strategic plan, but we don't move forward with implementation. So it's really important to think about how you're going to approach it and how you're going to move forward. Next slide, please. And there are consequences. I'd like to think there are some very positive consequences of hospitals getting involved in community health activities and really focusing on improving the health of not only individuals, but groups of individuals in your community. I think that if you're a small hospital, people are going to have more confidence in you. It could reduce out-migration, which is always a big problem for at least many small hospitals. But there's also a stick aspect that if you don't do these things, adopt a community health needs assessment and implementation plan, you could be fined up to $50,000, or you will be fined $50,000 and lose your nonprofit status. So this has happened. I know it hasn't happened frequently, but every once in a while I read about a hospital that has lost their nonprofit status and has been fined $50,000. So it's important to take this seriously. And I know most hospitals in Iowa have, just by looking at their data that we'll go over in just a minute here. But you can really make this an important process for you and really be helpful to people in your community and improve the health of people in your community. Next slide, please. Well, I'd like to look at some of the strengths and weaknesses of the community health needs assessments of your Iowa plans. And this was put together by Cassie Kennedy with the Iowa Office of Rural Health. She did a really excellent job and prepared a very nice report, which some of you may have already read. But I'm very impressed with the work that your hospitals are doing, and I'll comment on this in just a minute here. But of the 46 nonprofit rural hospitals examined in this study, 41% met all of the IRS requirements, which is really quite good. I've done this work in Nebraska, and I can tell you that we didn't get close to 41%. All 46 hospitals made the needs assessment widely available, which is also very good. It's an easy thing to do, but sometimes it's overlooked. Next slide, please. Well, some of the strengths, and these are very impressive, define the community served, 93%, the process and methods used, 89%, description of data and other information, 98%, and description of data collection and analysis, 98%. Those are very high numbers. As I said, I'm very impressed. Next slide, please. Description of the process for soliciting input from persons representing the broad interests of the community. 87% is still very good. Description of the priority process, 98%, which is really excellent. So a lot of you have really, almost all of you have thought about how you're going to set your priorities, which, as I mentioned earlier, is really an important aspect of this process. Next slide, please. Some of the weaknesses, description of the resources potentially available. This is really not too bad at 70%. When I did this in Nebraska, it was much lower. It was in the 40s, I think. And evaluation of the impact of actions undertaken to address the priority needs in the previous needs assessment, 72% is still very good. So you must be doing a lot of things very well on your evaluation, and documenting the community health needs assessment by an authorized body or board. That was only 61%, but that's easily correctable. It's probably just an oversight and something that can be cleaned up very easily. Next slide, please. Well, I'd like to shift course a little bit and talk a little bit about some best practices. And I know you're going to have a webinar on best practices, but as I mentioned, I just want to mention a few things about some of the things that you could be doing. And perhaps this will generate some questions as well. And I hope that during our discussion, you'll share some of the things that you're doing. It's always a good idea to establish a community coalition with a diverse membership. Now, maybe you do this in conjunction with your local health department, or maybe you do it on your own. But regardless, you need partners if you're going to address complex issues. And all of the needs that I've seen involve very complex issues. It's really important, as I mentioned, to work with your local health department, or perhaps your state health department, or your Office of Rural Health on data and information. Don't reinvent the wheel, as they say. If a survey's already been done, then take advantage of that. Ideally, the priorities in the community health needs assessment of your hospital should be the same as those in the community health improvement plans that your local health departments are writing. So perhaps there can be some slight changes. And certainly when you get to implementation, it doesn't mean that you have to be doing the same things in terms of implementation. But if you have all different priorities and you're all working on different things, that's not going to lead to a cohesive implementation strategy. And of course, chances are you're not, neither the health department nor the hospital is going to be successful in your implementation efforts. So I really encourage you to come up with similar, if not identical, priorities. Next slide, please. Well, some other best practices, build a cohesive community-wide implementation plan. I did a survey of local health departments in Nebraska and asked them, how close are you in terms of working with your hospital on their community health needs assessment and their community health improvement plan? And I got a very high percentage, over 70%. But when I asked them, how cohesive are your implementation efforts, I got something like 30-some%. I think it was 35, but I can't remember right now. So, really a significant difference here. And I think it's really important to develop a community-wide implementation plan. Again, that doesn't mean you have to be doing all the same things. It doesn't mean that your hospital can't do some things that they've always done in terms of community initiatives. I'm not saying that at all, but again, if you have a disjointed type of effort, you're not going to be very effective. Use evidence-based interventions, and your local health department should be familiar with community-based evidence-based interventions. There's a community guide that CDC has, that county health rankings that I referred to from the University of Wisconsin also has implementation activities. And of course, there are other sources as well. And I know you're going to have a webinar on this, but I think it's really important that you not get off on practices that may not lead to good outcomes. and consider whether a regional coalition with shared resources would be more effective when you're addressing certain priority issues. So maybe multiple hospitals, maybe multiple health departments, maybe a regional coalition would be the way to go. I'm not saying that that should always be done. In fact, it isn't always a good idea, but sometimes it's worth considering. Next slide, please. Well, it's critical to identify all potential community resources, not only hospital resources, as I mentioned. And relatively few hospitals have done a good job of evaluating the impact of their implementation strategies. And one of the big reasons for that is that there is not a clear work plan with measurable objectives. That if you don't have measurable objectives with specific activities, it is really hard to evaluate what you're doing. And I found this when your activities are very general, when you do not have measurable objectives, it's almost impossible to do a good evaluation. And as I mentioned, but I just want to emphasize this, the role of the hospitals, the collaborators and the resources committed should be specific. Next slide, please. Well, some best practices on funding, and I'd really like you to think about this, and perhaps you already have, but all of you report on community benefits on your 990 form, and you report on charity care and research and education, but also on community health improvement initiatives. And when I talk to hospitals about linking their priorities and their community health needs assessment with their community benefit expenditures on community health improvement initiatives, there's almost no connection, at least that I can tell. And so I would encourage you to think about how you can use some of your community benefit expenditures and link those with the priorities in your community health needs assessment. It's one way to really think about funding. I'm not saying you have to use all of your money in your community health improvement initiatives on your community health needs assessment priorities, but it seems to me there should be a strong link there. Other areas, you might want to leverage resources from local health departments and other community organizations, or perhaps other providers in the community. They may not have a lot of dollars, but they may have in-kind work that they can do. Or also seek grant funds from the Iowa Department of Health, the Federal Office of Rural Health Policy, and private foundations. I'm working with 3 different organizations, hospitals and local health departments right now, with 2 of them have already received HRSA grant funds from the Federal Office of Rural Health Policy. And another one, I'm writing the grant actually. So I don't know if we'll get the funding or not, but it is a way to take your ideas and find other partners. You have to have at least three partners when you write these grants, and get some additional dollars to move forward. And then also possibly, depending on your Medicaid agency, but you could approach your Medicaid agency and ask them about some dollars for pilot projects, which usually don't cost a lot of money, but if you can demonstrate that you can save Medicaid money by keeping people healthier, they might be very interested in what you're doing. Next slide, please. Well, these are a list of the Iowa health priorities. The hospital high priorities are on the left. The county priorities are on the right. And you can see that mental health comes up as a high priority for both. Obesity comes up as a high priority for both. some differences in the percentages, but also substance abuse comes up as a high priority for both. Then health education, chronic illness, tobacco use also are fairly high priorities. But we found in Nebraska that mental health and behavioral health in general is always 1 or 2. Obesity is always 1, 2, or 3. And chronic illness tends to come up. Sometimes access to care comes up as well as a high priority. So these are fairly standard from what I can read across other states as well, especially obesity and behavioral health, although of course there's some variance across various states. So next slide, please. Well, just a few things, I'll wrap this up quickly, about improving health in the community. I think it's always important to think about what you can do as an individual hospital for treatment, but also for prevention. And hospitals need to consider their role in improving community and population health. And community health involves examining all of the components of health. Next slide, please. We can argue about these percentages. Sometimes healthcare is 20% and not 10%. But we know that if you are not working on the left side of this figure on the social determinants of health and individual behavioral risk factors, that you are not going to have a significant impact on improving community health. So I would encourage you to look at your implementation activities and think about how much you're working on individual health behaviors and social determinants. And if you're not doing much, to maybe rethink your implementation activities. And it's certainly all right to focus on clinical things and look at your individual hospital needs. But if most of your focus is on individual hospital needs and not on community health needs, then maybe you're not focusing your implementation activities in the right way. Next slide, please. So there are numerous interventions. So some questions to think about. Where are your activities held? Who are the populations targeted? What is the content of the programming? And to what extent do the activities connect with vulnerable populations where they might normally not have access? Next slide, please. So you may do health fairs and people say, gosh, health fairs aren't very good. They don't really get at community needs. Well, if your health fair only targets and is held in an area where it only targets people with good insurance coverage and people that normally get care, then I would say a health fair is not really a good community implementation activity. But if your health fair is targeting people that normally don't get good regular care, maybe in a part of town, depending on the size of your community, where that don't usually have an adequate supply of health professionals, then a health fair can be very good. Telehealth the same way. Are you reaching all of your populations, not only people that, pardon me, not only people that have access to computers in a high income area? You could be screening patients for depression. I'm working with a clinic in Nebraska where they started doing screening for depression. And within the first month, they identified 2 patients that were really having serious problems and really at pretty high risk for suicide. How are you using community health workers? Are you linking community health workers with underserved patients in your community? Or hiring a social worker in the physician's clinic? Providing free mammograms for the uninsured? Doing walking trails and community gardens? I'm working, or not working with, but I talked to a hospital administrator in a very small community up in north central Nebraska, where they're doing community gardens. This is, a community of about 1,200 people. So you can do this. One hospital and local health department went to the city council to prohibit tobacco use in their city parks. This was a small community, so it's not a big park. And they wanted their park to be tobacco free. So there are numerous possibilities, and I know that you'll explore many of those later on. Next slide, please. Well, I just want to wrap up quickly here. Obviously, the community health needs assessment and implementation plans are important tools to address individual and community health. It can improve health across communities for vulnerable populations if it's done the right way and we have the right focus. Normally, you can't do this without other important partners in your community. So if you're not working with partners, obviously you should be. And if you are, try to expand them as much as you can. And the final note I'll just leave you with, is your hospital really committed to improving community health? Or are you merely checking off a regulatory IRS box? So hopefully you're doing the former. And based on the data that I've seen of your excellent work, I'm sure you're very committed to improving community health. So at this point, I'll stop and take questions or comments, or feel free to share any best practices that you're doing right now.
Thank you, David. I presented that question for everyone in the chat box. What best practices have you identified at your organization? While we're waiting for some questions to come through, David, I do have a question for you that perhaps you can speak to, especially with the point that you had just made about engagement and ensuring you're not just checking the box. Do you have any specific best practices you could share for leadership engagement, both at the hospital level and at the community level?
Well, that's a good question. I think it's always important for the hospital to have one or two people that are very familiar and work with community groups on planning and other types of activities. I don't always think it needs to be the administrator, but it needs to be people who are familiar with what's going on in the community and are good at cultivating partnerships and working as a partner. I've worked with local health departments and I've worked with hospitals where sometimes they go in and say, we're the hospital or we're the local health department and we're going to tell you how to do things. And I think it's really important that hospitals sit back and listen to what others have to say, and to always be appreciative of what others are doing in the community. And I think that hospitals can learn a lot from community-based organizations because most of them are focused on clinical work, which they should be, on treatment. And I know that many have diabetes prevention programs and other types of programs. So I'm not saying that hospitals don't work in the community at all. And I know many have been actively involved, but I've also seen areas and communities where it's just taken for granted that the hospital will always be the leader and dominate. And I don't think you always want to do that. I think that you have to find and build a well-rounded coalition and participate in that coalition as much as possible.
I agree. It definitely takes a partnership, integrated efforts across the board. It doesn't appear that we have any questions right now in the chat. I'll give a few moments there. I know you've gone through quite a few and then referencing Cassie's assessment that she had done. And I as well was excited to see how well Iowa critical access hospitals were doing with alignment with the IRS regulations. But across the board with your work in Nebraska, what gaps do you see the most in terms of alignment with the IRS requirements?
Well, I mentioned the resources not being comprehensive enough and looking at all the resources in the community, which really means that you're taking a much wider lens in terms of looking at community health. But I really think the most important one is evaluating what your implementation efforts were, how successful you were in your previous community health needs assessment and implementation plan. I've just seen not very good efforts there. And so it's really difficult to evaluate how well we're doing. And now, you know, we're talking about very difficult problems. Any type of behavioral health issue is going to be difficult. It's hard to go out and recruit new behavioral health providers and add to what you already have. And in some areas, they don't have any in their communities. Obesity is a very difficult area. There are things we can do, but it's complex and involves a multiple approach. You need multiple activities. So, but on the other hand, if we don't have a cohesive approach and know what each other is doing and know how well we're doing, then you're just going to be doing the same things over and over again. And I think to really make progress, that evaluation is really important. So it starts with measurable objectives, and it starts with specific activities. I know that not all hospitals can afford to go out and pay a university professor to do an evaluation. I don't charge very much, but a lot of my colleagues charge a lot, and I wouldn't, you know, they just don't have that kind of money. But if you do those basic things, then it's going to be possible for you to assess how well you've done over the past 3 years. And of course, these are all things too that are going to take multiple years and multiple planning periods for you to perhaps even make a dent in your obesity rates or in your diabetes rates or your hypertension rates or whatever the case might be. So those would be the two areas that I would think would be the most important from a technical standpoint. We talked about partnerships and developing partnerships. Easy to say and harder to do, especially to make it work, is obviously an important aspect.
Agreed. Well, that brings us to a close here to the presentation. I just want to thank you again, David, for your presentation today. I especially enjoyed hearing the best practices that you had shared. I want to thank everyone that did join us for your time. And prior to this presentation, we shared a resource to supplement the content today and also align with the assessment that David had mentioned that Cassie Kennedy had created. This is a community health needs assessment checklist to serve as a planning tool to help ensure compliance with the IRS regulations. Our next, right, we really look forward to connecting with you again on February 10th at 11 o'clock a.m. Cindy Winters will be presenting on how to plan for a successful CHNA. This will incorporate how to build a diverse planning team to evaluate, truly to elevate and expand the benefits of collaborative efforts. Really that you'd mentioned, David, today about how valuable that is. We'll also identify best practice examples to explore as options to improve community engagement across the board. After the presentation today, we will also be sending a link to the recording and the series brochure. So if you haven't registered for the final 2 webinars, please do so. And also please share broadly within your organization. As David had emphasized, it takes a team. So let's make sure all those players are on board. Share at all levels to support the need to increase this engagement. Share broadly within your community, with your coalition members, with your local public health partners, so that across the board we can increase and improve clinical community integrated efforts, improving the overall health of our communities. We look forward to supporting you along in this journey. And so that wraps up our presentation for today. Thank you all and stay well.